Hello, welcome back. Are you farting too much? That is the topic we are going to discuss. In the previous videos, we already told farting or the gas or passing wind downwards. It's a natural phenomenon which is nothing but a byproduct of the normal digestion. But when it goes beyond certain frequency or numbers, or the smell is too much, then this has to be looked in. Or is it something to be treated? See, usually the fat or the gas is a natural byproduct of the digestion, so it depends upon mainly about the type of food what you are taken. So suppose you are taken some food like non-veg, too much of non-veg, then product definitely the byproduct of the gas will be little smelly, or it could be little disgusting. Or maybe suppose you are taking too much of protein, especially protein rich diet, so the byproduct will be more gas. Or if you are taking even carbohydrates, most of the people think carbohydrates cannot cause gas. No, even carbohydrates can cause, especially the saccharides, which are the enzyme which is very less. Suppose the carbohydrates can produce a lot of gas in the small intestine, which can be passed on. So, and any vegetables, especially that grows below the ground level, the what called the tuberous thing, like any potatoes. Simple thing is potato. When you digest, you produce a lot of gas. So any anything that grows below the ground level, they can cause a lot of gas. Or some other diseases. Suppose you have an ulcer, or you have a Crohn, inflammatory bowel disease like Crohn's disease or ulcerative colitis. They can produce a lot of gas. They can cause smelly gas. Of course, they will have other symptoms for the other diseases, but they can produce a lot of gas. Some diseases like suppose you have a tuberculous intestine, they can cause a lot of gas. But generally, even the drugs, suppose you are taking an antibiotic, a course of antibiotic, they can literally can irritate your stomach, or they can kill the bacteria. So the normal bacteria level comes down, so the natural byproduct of gas is not absorbed by the bacteria, so they produce a lot of we pass a lot of gas. Even some drugs like iron supplements, so iron capsules are all really, they can burn your stomach, causing constipation and gas, or even diarrhea with the gas. So these are the causes for the or even there is a bacterial imbalance. The gut microflora is imbalanced because the good bacteria is less and bad bacteria is very high, because of a diet or maybe some this thing that can also cause a lot of gas. But in the modern world, it's all depends upon the main reason for the farting is mainly your body weight, obesity. Obesity is the one major reason for excessive passing gas. When somebody is obese, so the most of the weight is also on the intestine. Normally intestine has to do the peristalsis to push the the food or the byproducts of the food, gas, liquids down. But if somebody is obese, the peristalsis, the number of peristalsis comes down, so there is a stagnation of gas and the motion. They accumulate, then they can come out. So the obesity is one of the main reasons. So the other reason is constipation, because of the sedentary lifestyle. Or even after 40 years, usually the physical activity comes down. So, or people will have a diabetes, hypertension, making people to get constipated. So these can cause a lot of passing gas. So usually in a day, we always say even 10 to 15 times if you pass fart, if you fart 15 times, or even you pass wind downwards 15 times, we always say normal, provided if it is accepted by the society. It's actually social taboo. Suppose somebody is a driver, working as a driver in an AC car, suppose he passes, it's very embarrassing. Or people working in the IT, in a closed AC room, so it again becomes a serious thing. So always, if it's really, you feel if it's really disturbing, it's not accepted by others, then you have to see the physician. So he will examine you, ask so many questions and histories, and then he asks for a endoscopy, coloscopy, scan to rule out other things, all these things. Then he can treat you for the disease. Or if it is a natural, only a constipation, probably he may supplement, he can give you, he can change your diet, he can give you some dietary advice, he can give you some supplements for the digestion, or he may even give you some antibiotics to kill the bad bacteria, so to bring back the balance, the good and bad bacteria, or even prescribe the probiotics, to get the good bacteria to grow. So these are the simple things, But if it's really smelly and if it is unbearable for even, for you, even to the person itself, then it needs to be seen immediately, and it can be easily cured. It could be farting or the gas is not a disease; it's only a symptom. It may be telling you some other problem. So the doctor can easily pick it up and he can treat the disease. Thank you.